Hi, my name is Dan, and today I wanted to talk about music therapy in the treatment of depression. Recently, I was at a concert at Mr. Small's Funhouse. It's a small concert venue in an area called Millvale of Pittsburgh, and I was getting really into the music. I was enjoying the concert, and at one point I came back into like a present awareness of my body, and I realized that I had a huge smile on my face, and I was having such a good time. So I started to think about how music can be effective in treating low mood and in treating depression. And it brought me back to when I worked on a child and adolescent psychiatric unit and an adult psychiatric unit in Kansas City. And both of those units had a music therapist. So for the beginning of my career, I thought that this was a standard part of a psychiatric unit, until I started to work in different areas and work in more units, and some units didn't have music therapists. So I saw that although I was fortunate to experience it in Kansas City, not all the units and psychiatric units have a music therapist. And the first session that I remember listening to was on the child and adolescent unit. And it was a group session, so a bunch of adolescents were sitting there with the music therapist. And she played a song that's called Mansion by NF. And unfortunately, a lot of the pediatric patients and adolescent patients that you see have a history of abuse and a history of negligence and a history of a lot of unstable relationships with parental figures and other figures in their life that are supposed to take care of them. And this song by NF seemed to address a lot of those similar issues. So it was really interesting to just watch the therapy session and see the kids listen to the lyrics and kind of relate. And then after the song was played, the music therapist went back to certain sections of the song and certain lyrics and asked the kids about their experiences and how they interpreted the lyrics. And it can be hard to get adolescents to participate in a group session and on a psychiatric unit. And you could tell that the kids were feeling emotions and getting passionate about telling their stories and relating to the music. You could tell that she was really connecting to the kids. So I got to see firsthand just how effective music therapy can be. On the other side of that, on the adult unit, when we would do rounds in the morning, so see each patient on the psychiatric floor, we had a multidisciplinary team. So the attending psychiatrist, medical students, medical interns, medical residents, pharmacists, occupational therapists, social worker, and then we had a music therapist actually come with us as well. So our team was really broad team, and we brought experiences from a bunch of different areas. And since I've worked on that unit, I have not seen a music therapist come on rounds again. And it was a really useful tool because the music therapist got to see what the patient's stories were from the side that they were telling the psychiatrist and maybe incorporate that into their music therapy sessions. So I'm definitely for and a fan of having musical therapists available on psychiatric units, and I've seen firsthand the effects and the positive effects that they bring to the unit. I wanted to talk about some of the medical literature to support music therapy in the treatment of depression. So it's not just my personal experience, there is a lot of evidence to support this as well. The first trial is what's called a Cochrane review. So it's a meta-analysis of a few different trials. In this case, there was 9 trials, 411 total patients, and they looked at all age ranges. So 2 of the trials were from high school students. One of the trials was from a nursing home, and so on. So a pretty broad range of patients. And they found in this meta-analysis that music therapy decreases depression scores, decreases anxiety scores. In fact, they looked at they converted the scores to the Hamilton depression score, and they found a 9.8 decrease in depression, which is absolutely huge. A 9.8 decrease on this specific scale can be the difference between severe depression, so the worst case, to moderate depression. So just with music therapy, you can go down from severe to moderate. So I found that really interesting. And if there was a medication that came out that decreased depression scores by 9.8 points and had no side effects, like music therapy in this case showed no side effects, it would be a blockbuster drug. It would be $1 billion drug. So this just further helps my case that music therapy should be a part of all psychiatric units. The next trial that I wanted to talk about starts to break down music therapy and look at some of the different variables. So this trial was out of Thailand. Not a lot of patients in it, only 14, but what they compared was active music therapy versus passive or receptive music therapy. So an active music therapy would be a therapy session where the participant plays an instrument or keeps rhythm somehow or sings, whereas a receptive music therapy is when the person in music therapy listens to the music. So this trial wanted to compare the two and see if one case was better than the other, and compared the patients with standard counseling as well. And what they showed was both the active music therapy and the receptive music therapy both showed benefits with depression, and was only slightly better than the standard counseling group, and it was non-statistically significant. So they pretty much all showed a similar benefit. And I found this good to know because, like I was saying before, it's starting to look at some of the variables. So we kind of know that music therapy works for depression, but I want to see what type of music therapy. I want to see some of these variables ironed out. So that's why I included this study. So next, what I wanted to look at was whether it's just music in general that is decreasing depression, or if it's actually the music therapy that's decreasing depression. So I found this really interesting trial out of Germany with 117 patients. And in this trial, the patients were from a nursing home, and they either received the music therapy with a music therapist, or they participated in like a recreational group singing activity. And this took place over 12 weeks. So what they found was at 6 weeks, the MADRS, which is a depression scale, was decreased by 3 points more in the music therapy group. So with the music therapy, decreased depression scores more than just the recreational singing. And then at 12 weeks, the score dropped even farther. So 4.5 points difference in the MADRS with the music therapist as compared to the recreational singing. So again, I wanted to look at a trial like this to see, is it just music in general, or is it the active role of the music therapist that's causing the difference? And although music still might be helpful on its own, the music therapist being there definitely adds a benefit to the treatment. The next trial that I wanted to talk about was another really interesting trial. So I believe this one was out of Pittsburgh, and they looked at 106 adolescent patients, and they looked at the type of media that person used. So the different media options were television, movies, music, video games, internet, and then print media such as magazines, newspapers, and books. Of the 106 patients, 46 of the adolescents were diagnosed with major depressive disorder. And when they broke down the type of media used with depression, they found that the more that a adolescent listened to music, the higher odds that person had depression, whereas the higher that person read books or looked at print media, the lower odds that person had depression. So I read this study and I thought about it for a really long time, and it's really interesting. It caused me to think about a lot of things. So this doesn't necessarily mean that music is causing depression in the adolescents. It could be almost the opposite of that, in that the kids that had depression seeked out more music and listened to more music because it was helpful for the symptoms of depression. So it could go either way in that case. And then my theory behind the book, the reading component, where the kids that read more had less depression, one of the symptoms of depression is decreased concentration, decreased ability to concentrate. So the kids that had depression may have had trouble focusing and reading a book. So that might be why the kids that did not have depression seem to read more books. So I just wanted to include this trial in here because I found it really interesting, and it really, like I said, caused me to think a lot about this. Okay, one more trial I wanted to talk about. This one was out of Australia in a college there. And what they looked at was 177 undergraduate patients. And the patients were, well, I guess not patients, just college students, were randomized to either the happy listening group or the sad music listening group. So they had different playlists. The happy music had happy music, the sad music had sad music, and they looked at how the type of music affected mood. And what they showed is after the initial listening session, the happy music seemed to benefit mood, but the long-term effects of the playlist didn't seem to have a difference between the happy music and the sad music. They did find one interesting subset of college students. So in the sad listening group, the college students that had high rumination scores, so that they would think about things over and over, sometimes would feel worse after listening to the sad music. So they might ruminate on that and incorporate that into their mood. But overall, in this trial, the type of music didn't seem to affect mood long term. And this got me thinking as well, does type of music matter? Would it be bad or wrong to play sad music for someone with depression? And this is just my opinion at this point, or my theory, but I don't think it always would be a bad idea. One of the symptoms that I commonly see with people with depression is like an apathetic response. So they're neither happy nor sad. They kind of feel nothing. And I think in this case, if they wanted to listen to sad music, that it might be beneficial to feel sad over than feeling nothing at all. And I think there could be more evidence that looks into the type of music, but also type of music can be subjective as well. So if there's a sad artist and maybe you went to their concert a really long time ago and hung out with friends and had a great time, you might associate personally that sad music with a really good and really fun time, and it might make you happy. So there's so many variables here that I find interesting and just wanted to touch on briefly. So to wrap up, the Cochrane review, which is high quality evidence, definitely shows the benefit to music therapy. I think that this should be a part of every psychiatric unit because it's virtually side effect free and shown to be effective. There's also outpatient music therapists. So if you're not in the hospital, I've looked online and found some music therapists. I've been kind of exploring ideas that I could do at home. So one of the ideas I was calling like active music listening. So I was getting a printout of the lyrics to the music I was listening to, and rather than just having it play in the background or looking at my phone or working on the computer while the music was playing, I read the lyrics and focused on the music as much as I could while it was playing, and it felt really good and therapeutic. It felt almost like a meditation session that you were forcing yourself to stay in the present moment because you were reading the lyrics and interpreting the lyrics and having the music come into your ears and listening. So many things were going on that it was hard for my mind to wander. So that's pretty much my thoughts on music therapy. I think it's definitely great and can help people with depression. I'm going to try to explore more things that I can do at home with music rather than just seeing a music therapist. But like that one trial showed, having that guided, trained music therapist seems to be better than doing your own thing, at least for now. So that's it for this review. I hope some of the information was helpful. I hope the going over some of those trials was helpful as well. Thanks for listening.